Okay, this is an introduction to assessment task 1 for cluster 1. We're just going to go through the questions briefly and explain what you need to do to answer them each correctly. So for question 1, list and describe the 5 major types of cell adaptation. Again, list and describe means you're listing the 5 major types and giving a sentence for each. Question 2, describe each of the following processes. 1 to 2 sentences for that question. Question 3, define the following terms. Um, a sentence each will be all that's necessary. Question 4, give a brief description of the effect of biological maturation and aging processes on body systems and their components. Brief description is a sentence or 2. Going down to question 5, use dot points to outline the signs and symptoms of a person being impacted by these things. Dot points underneath, and you're wanting at least 3 or 4 for each one. Question 6, what are the general healthcare needs of the following groups? A couple of sentences will be for each one of these, maybe 2 to 3 sentences describing a little bit of the general healthcare needs of those groups. Question 7, the relationship between homeostatic imbalance and disease. Describe another sentence or 2. Questions 8 and 9 is just going to be a description, that's one sentence. Question 10 is just a number, basically, or a range of numbers. Question 11, just a list of 4 things. They don't need to be described. Question 12, um, an example and a statement. So you're giving us a brief explanation of a sentence or 2 and an example of each. Question 13, answering that question with just a sentence or 2 of description. Question 14, you've got a 2-part question. Again, a sentence or 2 will cover that question. Question 15, what is the function of buffers? A brief description is only a sentence necessary. Question 16, describe how the respiratory system reacts to an increase in carbon dioxide in the extracellular fluid. A sentence or 2 should be adequate to give a brief description on that. Question 17, how does the renal system help control the body's pH? Again, you may need a couple of sentences for that. To briefly summarise what the renal system does in helping control the body's pH. Question 18, define the following conditions and give a possible cause for each one. So for each one of these, you'll need to give a definition, which will be a sentence, and giving a possible cause, which is probably just a few word statement at the end. Question 19, provide examples of each of the following types of cellular adaptation. These are these 4 on the left-hand side, and then filling in the table along here. If you need more room, they will expand out. You're giving examples of each one, but if you want more room, then the boxes will expand out. Question 20, fill in the gaps. Along the top here are all the words that fit in to these questions here for question 20. So you'll just need to take each one of those and fill them into the appropriate boxes. Question 21, how does trauma impact on someone's ability to? For each of those ones, you want to give at least a sentence or 2, giving a description of how trauma impacts those things. Question 22, what documentation is required for an effective clinical handover? A list of documentation. You're wanting at least 4 or 5 factors put in there for question 22. 23, briefly describe at least 4 factors that inhibit communication. It doesn't limit you to 4, but at least 4. I want listed and a description of each one, how they inhibit communication. And similarly, question 24, briefly describe at least 4 factors that facilitate communication. So you're looking at the opposites there. The first one is that 4 factors that inhibit communication or prevent it, stop it in some way. 24 is 4 factors that facilitate it, what makes it easier, and how do they do that. Question 25, according to the open disclosure framework, what is it? And briefly describe the associated principles and practices that will be in your books. Question 26, list the relevant core standards for nurses who support people with a disability. So that's referring to the specific core standards for nurses who are working specifically with disability. What do they tell you? A couple of sentences there. 27, what are the legal requirements surrounding nursing documentation? You're looking at least a few sentences there. You may want to put dot points down with a short sentence beside each one, bit of description. Question 28, whole list of abbreviations. You just need to write beside it what each one stands for. Question 29, what needs to be considered by a nurse when caring for a patient who's suffered sensory loss? I'd expect a couple of sentences of information there, giving a bit of an explanation of the kind of considerations as a nurse you would need to take into account when looking after someone with sensory loss. And last question, 30, is describe an example of how each of the following can lead to a disease. Describe means a sentence or two for each one. Most of these, you'll find the answers in Foundations of Nursing or Health Assessment and Physical Exam. Certainly look them up on Joanna Briggs or on Cengage. Okay, all the best with that one.